What's it say?
I'm not going to have an argument with you, but
It says everybody in the United States should be treated equally. Why should Nebraska, Louisiana, the unions, and everybody else get a different deal than everybody else in the United States?
And
I know you're a Democrat, but I'm saying it ain't working.
And I respectfully say you should let Congress know what you want to see happen.
I do.
Make sure that you let Congress know that you obviously don't want this to move forward. I want to see what other questions I have. I'll take you and then back, and then I'll go to you and then the red.
What would happen with all these young people that don't have insurance and all the people that need insurance if they were all put into Medicare? We have a lot of young people that are not going to use it. Yeah, let's use what we've got. That's what I'm for. It's not going to happen.
Medicare for all. That was actually something. Right. That was something that several years ago many folks thought we were pushing towards a time when we could either choose to buy private insurance or choose to buy into Medicare. That was something that a lot of people were working on. And one of the advantages of that is that the overhead in this program, because it's a nonprofit and it's pretty efficiently administered compared to even any of these other programs, is between 1% and 4%. But the one thing that we've learned is that there was not political will and that there was not a lot of voter support for that, and it fell off the table really early. So that's a question for another period of social change. It's not a question that has really been seriously asked or answered in this one.
Tell them also Medicare, you said 1/4 to collect. Tell them what private insurance charges on every dollar we spend on our private insurance. Tell them how much the company keeps and what they spend on us and what they keep.
So the question is the overhead in these different models, and that is also a big part of what Congress was trying to take on. In the Medicare program, the administrative and overhead costs are between 1% and 4%. It's different in different parts of the Medicare program in terms of how much. Part D is one of the highest because it has private insurance plans in it. In Medicaid, depending upon the state, it could be between 5% and 7%. So that's the total money in, how much of it is going for administrative costs and overhead, and in some instances profit, but not down here. In the employer insurance market, the overhead costs, because there are significant rules and protections, and the pool is very large, and insurance companies have to negotiate with large employers, the overhead is about between 10% and 14%. So the amount of money that goes into either profits or administrative costs for every dollar spent is between 10% and 14% in the employer market. But over here, it's between 20% and 40%. So the individual insurance market that we currently go to as if we're uninsured individuals or small businesses, is administrative and overhead of 20% to 40%. And part of that is because of there are no rules. So when I go and I apply for a policy, then they ask me for my whole health history, and then they pay to get my medical records, and then they might send me for a physical, or they might want me to get blood work. Well, all of that costs money, and all of those costs of them deciding whether or not to give me a policy and how much to charge, those costs aren't in any of these other systems. So it is much more efficient if you look at it objectively that way. Gentleman in the red shirt, and we're over time, I must confess.
In the first session, Frank asked, is there any physicians here? And I think I was the only one that raised his hand. First of all, I want to say thank you to Amy. This has just been a real good overview of what's going on. And I think we all need to kind of know the basics of what they're all talking about. We hear little snitches here and there, but this is a good review. But I think two things that you all need to know. One, at the end of this month, Medicare is going to get chopped, and so is the payments to all those people who fought overseas, because we're going to save money, so we're going to chop that 20%. Well, what is that going to do to those who are on Medicare right now? I'll tell you what it's going to do. In the surgery meetings I'm at, and in the physician meetings I'm at, guys are saying, I'm already losing money on Medicaid. I can't afford to lose money on Medicare. I'm going to quit taking my Medicare patients. So you need to let your legislators know that at the end of this month, if they don't at least fix that, you're probably not going to have your physician to go to. Okay? And as a physician, I'm in this because I have felt God called me to this. And because of that, I don't mind taking people who don't have insurance or who are on Medicaid or Medicare. But I have to tell you that 1 out of every 6 people I operate doesn't have insurance. And after a while, So we need to let them know what we think about things, but we need to say the insurance companies have to give up something, the people have to give up something, the physicians have to give up something, and the lawyers have to give up something. We've got to get this balance